Good afternoon, everyone. Thank you so much for joining our session on listening to our trainees, why their voice matters. I'm Radha Segal, and together with Venetia Perrett, we are both doctors and National Medical Directors Clinical Fellows at Health Education England. So why does the trainee voice matter? Listening to our trainees enables us to understand their experiences on the ground and how they perceive their own training. This ultimately leads to outcomes which can be broken down into quality, well-being and influencing change. Hearing our trainee voice enables us to ensure we are meeting quality standards, but it also drives quality improvement in education and training. It enables us to prioritise and target interventions, gain feedback on whether these have worked, and promotes good practice. With regards to well-being, it enables trainees to raise concerns and therefore address current but also plan for future workforce issues. And thirdly, it influences positive change on a local, regional and national level alongside fostering strong partnerships with learners. There are many ways in which the trainee voice is captured. This list is by no means exhaustive and will elaborate on some of these examples. Routine cyclical feedback about quality via surveys, including the HEE National Education and Training Survey, or the NETS. Rapid or deep dive feedback to provide insight at a point in time where there may be concerns about quality or learner well-being, such as the localised NETS and action surveys. Forums to facilitate collaboration and greater depth of engagement with students and trainees, such as the National Trainee Engagement Forum, or the NTEF. Ongoing touch points throughout a learner's educational journey, and direct feedback about their experience of HEE, such as through the recently undertaken Pulse survey. The diagram shows a visual representation of the various touch points that a trainee will have with HEE before they reach their Certificate of Completion of Training, or CCT. Each touch point acts as an opportunity to influence the trainee's experience with HEE. Following the roadmap, we can see that these begin at undergraduate level, during recruitment into medical school, as well as during placements. This continues into foundation years and beyond, including rotations, newsletters, webinars and social media, through supervision and portfolio assessments, specialty recruitment, flexible training and annual review of competence progression. This elaborates on specific examples of how HEE engages with the trainee community. There is both external and internal examples, and this has broadly been divided into forums and surveys. Starting from the top left is the National Trainee Engagement Forum, which we will come to talk about shortly. HEE and the Academy of Medical Royal College's Medical Education Forum comprises a forum of Royal College representatives, leaders within HEE and the BMA, where trainee voice is key and represented by the Academy Trainee Doctors Group. Externally, other forums include the BMA Junior Doctors Committee, consisting of elected junior doctor representatives from national and regional committees, and the Academy Trainee Doctors Group, both of which are invited to HEE meetings to represent trainees. National surveys run by HEE include the NET survey, which is a multi-professional survey running twice a year that asks about the quality of the learning environment, and the Pulse survey, which interviewed 24 stakeholders on their perception of HEE. Externally, the GMC conduct the well-known annual National Training Survey of all postgraduate doctors in training and trainers. This snapshot encapsulates the National Trainee Engagement Forum, or the NTEF. As the name suggests, it's a national forum which creates a grassroots community of trainees and multi-professional learners from across the country. All trainees are invited to unite via this national platform to influence educational practice and policy, communicate ideas, and provide feedback. It began in March 2021 as a means of bringing the trainee voice centrally to HEE and allowing it to shape and reform practice. The forum is split into the NTEF meeting and an insight event. The meeting has trainee representation from all regions and is a safe space to share concerns as well as best practice, and involves an interactive workshop. The Insight events welcome senior leaders to talk directly with a panel of junior doctors to explore topical issues and encourage blue sky thinking. The most recent event welcomed Professor Chris Whitty, Professor Wendy Reed and Dr. Navina Evans to discuss how doctors in training can address health inequalities. Feedback reports that attendees highly valued hearing directly about HE's future vision, as well as having the opportunity to ask questions directly to senior leaders.
Thank you, Radha. Hello, and firstly, it's a pleasure to be here and have the opportunity to share some insights into Health Education England and the organisation's work with trainee engagement. My name's Dr. Venetia Parekh, and as mentioned earlier, I am one of the fellows working at HEE this year. Following on from my colleague Radha, who has discussed how we capture the trainee voice, over the next 5 minutes or so, I will outline some of the ways in which HEE has acted upon the trainee voice. In the next few slides, I will take you through some programmes and initiatives that have been informed by trainee feedback and how this has led to improving the trainee experience and well-being. So first, to recruitment delivery. HEE is responsible for recruiting to postgraduate medical training programmes. Annually, over 35,000 applications are received for around 12,000 vacancies. In 2021, a survey was sent to all applicants for that year. This feedback has been incredibly useful in ascertaining trainee views on specific aspects of the recruitment process and to understanding any issues. Questions included, for example, whether doctors felt their application had been detrimentally affected by COVID, and whether the selection processes used were fair. Some of the lessons learned from this survey include the need for more proactive communications, especially when there is change. Also maximising opportunities for application and thereby also limiting vacancies. So, for example, through additional recruitment rounds as required and multiple programme start dates in each round. And also a need for new digital interview platforms which offer greater functionality. Next, I'm going to move on to the COVID training recovery programme. This has 3 key stages: reset, recover and reform. A major part of this programme is to support trainees to gain and evidence competencies acquired during COVID and to address trainee wellbeing and confidence issues. The pandemic has impacted every trainee on an individual and personal level, with no 2 trainees having the same experience. While many trainees have missed out on essential experiential learning, others have had the opportunity to acquire clinically and professionally relevant skills. Recovery solutions must therefore be individualised. Trainees have been offered one-to-one conversations with their educational supervisor or training programme director. These conversations have helped both trainees and trainers to gain an understanding of skills gap and capability confidence gaps, as well as wellbeing needs. This has allowed TPDs to forecast potential extensions more accurately and enable trainees and trainers to take proactive actions to addressing training needs. Trainees have also been able to directly inform effective recovery solutions through direct feedback via the COVID-19 training risk reporting tool. This approach to recovery has the potential to build greater flexibility into training pathways, providing greater resilience in the medical education pipeline and trainee service delivery, as well as resulting in increased trainee satisfaction in the future. Finally, I am going to briefly describe the supported return to training programme. This programme was established in 2018 following feedback from trainees. The aim, as the name suggests, is to provide additional support to doctors when they return to training following some time out. Activities include access to simulation, short-term supernumerary working, and coaching and mentoring. I have had personal experience of delivering this programme and feedback from participants has been very positive. In this final slide, we summarise HEE's hopes and plans going forward. HEE is committed to both enhancing awareness of its programmes and initiatives, as well as establishing, maintaining and growing engagement with trainees. Radha and I thank you for taking the time to listen to our presentation today, and we would be very happy to take any questions.